Hi everybody. As I mentioned earlier, today I'm going to talk about some muscles and bones and joints that are involving in spreading your fingers out and bringing them in. So, as you know, during everyday life, you are using these fingers like spreading out them and bringing in. So, for example, when you are grabbing an object like cup of coffee, you are bringing them in to hold the object, or when you are typing, working with the keyboard, or when you are playing piano, you are doing this. So they are really important. So today I'm going to talk about these bones and joints and muscles. In anatomy or anatomical word, spreading the fingers out is known as the abduction, abduction. So the reference finger is the middle finger. When you are moving the fingers away from the middle finger, it is called abduction. When you are bringing them in towards the middle finger, it is called adduction. So I'm going to show you some bones on my dorsal surface of the hand. So here we have the bone, it is called metacarpal 1, and then metacarpal 2, 3, 4, and 5, the last one. So they are numbered from the thumb side to the pinky side. For each and every finger we have 3 phalanges bone, proximal phalanx, middle, and distal, except for thumb. For thumb we have only proximal and distal. So I'm going to show you only the proximal phalanx here. So if you look at precisely here, we have some knuckles. These knuckles are formed by the joints between the metacarpal and proximal phalanx. They are called metacarpophalangeal joint, MCP. So we have MCP 1, 2, last one is the 5. So, and you can also see some muscles that are arising from the adjacent metacarpal bones, and they occupy the space between the adjacent metacarpal bones. These muscles are called interosseous. So we have 4 dorsal interosseous and 3 palmar interosseous. So here is the dorsal surface of the hand. It's called dorsal interosseous. Dorsal interosseous muscles are numbered from thumb side to the pinky side. This is the first dorsal interosseous, and this is the last one. And they do abduction. So if you want to memorize, you can use this mnemonic, DAB. D stands for dorsal interosseous, AB, abduction. So they do abduction. What about the insertion? The insertion of this interosseous muscle. So this interosseous muscle, they attach to the base of the proximal phalanx like this. So it makes more sense if you look at here, when it contracts the first dorsal interosseous, it can move this finger away from the middle finger like this. So, and if you look at here, when it contracts the last one, it can move the index, the ring finger from away from the middle finger. And these two that are attaching to the proximal phalanx of the middle finger, they can do side by side or side to side of the movement of the middle finger. So what about the palmar interosseous? As I mentioned earlier, we have 5 metacarpal bone, and we also have proximal phalanx for each finger, and here is the MCP joint from palmar surface. And now I'm going to show you the palmar interosseous. As I mentioned earlier, they are rising from the adjacent metacarpal bones like this. So we have 3 palmar interosseous, and again they attach to the proximal phalanx of the fingers, and they do adduction. And the mnemonic pad, P stands for palmar, AD, adduction, helps you to appreciate the movement of this muscle. Palmar do adduction, dorsal can do abduction. So if you look at here, you can see the first palmar interosseous attaches to the proximal phalanx of the index finger. It can bring it in towards the middle finger and do adduction. And these two also do this. They can do adduction, moving the ring finger and pinky finger towards the middle finger. So what about here? It has its own adductor. It's called adductor pollicis. So it attaches here and do, pollicis means thumb. It can do adduction of the thumb. So the name only changes. They have the same action. Just keep in mind, these 4 dorsal and 3 palmar interossei muscles also help the muscles that I showed you in my previous video. They are helping the lumbricals. So in addition to attaching to this proximal flanges, they also attach to the dorsal digital expansion like lumbrical and make L-shaped hand. So their primary action is abduction and adduction, but the secondary action is helping the lumbrical to do L-shaped hand. Thank you so much.